So I was asked to talk to you today, and I guess most of you are all infodemic candidates or unicorn candidates now. But I'm speaking to you today not from an infodemic manager, not from someone who has a lot of experience in infodemic per se, or infodemiology per se, but from a public health professional who's been dealing with the infodemic in one way or another, probably in a hodgepodge way. So that's the experience that professional experience that I'm going to be talking from today. And I know that Liz has really been using and coining the term pothole filling. Maybe she's right, because in fact, that's what we've been doing in public health for a very long time when it comes to dealing with the infodemic. It's just landing in a big hole and then figuring out how to fill it so we can stay above what's happening in the abyss of that hole. And if you've been to Canada, we have some pretty big sinkholes. So just to give you a bit of an analogy of where I'm coming from. So I have a few learning objectives that I hope you take away. And because I'm coming from a public health perspective, and many of you come from different backgrounds, you can easily replace what I'm talking about, which is public health and immunization, with your specialties and areas and how you're dealing with the infodemic. And so firstly, I hope that once I'm done with my presentation, you'll be able to identify the challenges within your own country, your agency, your department, your organization on how to address the infodemic. You'll understand the risks of not rethinking the way we communicate, because there are risks about how we've been doing the same thing over and over. And like the previous speakers, we're not seeing the results that we probably should. Recognize what you can do to encourage the implementation of infodemic knowledge. So you as an infodemic manager graduate is going to play a really key role in how we shape future guidance, future infrastructure on how to support research, how do we gain more knowledge, how do we respond better, how do we do everything better when it comes to the infodemic. So I'm just going to talk to you a bit about Immunizing Canada, because that's the organization that I run. We are a national coalition, and we have a specific interest in promoting the use and recommendations of vaccines by the National Advisory Committee on Immunization. It's our NITAG. So if you're familiar with NITAGs, it's our expert advisory committee that tells us how to do things when it comes to, indications for immunizations and vaccines. So our specific mission is obviously to contribute to the control, elimination, eradication of vaccine preventable diseases. And we do this through specific things such as vaccine awareness, education, media relations, and so forth. And so our mandate is really to be the go-to source of information for Canadians. And we really do our best to maintain a trustworthiness and independence voice in support of immunization. And so Immunizing Canada is a little bit unique. And I don't know if many of you are familiar with the coalitions in the US. So there are coalitions globally all over the place. VSN was mentioned. They're not really a coalition, but they're a network, but they kind of function in the same way. In the US, there are really good coalitions. Every state has a coalition. There's national coalitions, and they all work together. In Canada, we don't have that same infrastructure when it comes to a common voice. We're kind of disjointed. We're all over the place. And so what Immunize Canada aims to do is really bring together a lot of those different voices at one table. And so a lot of what you see around, so for example, social media, so Facebook, for example, that we work with, Professional Health Association, so the Canadian Medical Association, Canadian Pediatrics Association, patient advocacy groups, university researchers, public health authorities, the vaccine industry. And that's a big one because it's a bit taboo to have the vaccine manufacturers at a table like ours. But there are reasons for having them there, and there are rules of engagement. So they're not voting members, and they don't contribute to every facet of the coalition's work. And so together, we really work to build a cohesive voice that raises awareness and influences action when it comes to immunization. And I really like this quote. I use it a lot because coalitions are important. And I think as an infodemic manager, and I'll speak a little bit about it later, you need that kind of support, because once you're done being part of this utopia of infodemic managers, you got to go back into your day job, and you may not always have that support with you. So understanding and identifying who's around you, who you can work with to build stronger voice within your own organization can really make a big difference. So we've been around for 28 years, believe it or not. And so we have a long history and we have a lot of experience. And so what we've learned specifically, like I said, within the coalition is to work together. So all of these voices work together with a common purpose, a common goal. Some of the priorities don't always overlap, but when it comes to immunization, they trust that Immunize Canada will be able to be that voice. We want to better understand the gateways for communicating with the public about the benefits of vaccination. And so what are the prompts? What can we do to help with the prompts to receive a vaccine when you're meeting with your healthcare provider? Explore outside the normal communication avenues. So we've explored working with caregivers, employers on how to set up vaccination clinics in the workplace. Understand media, health and science literacy. My team is not really in that space. We're not communication experts. And so we have to build expertise, or if we can't internally, work with those that do have it. So we have to understand that we've had some limitations over the years. How do we gain that benefit or that added value? The other thing is be mindful of our target audiences. This is something we don't really often do in public health. And so for us, making that change was really critical. Learn how to repackage scientific knowledge. That's not easy to do. And so we've adapted different techniques, and I'll go over them later, about what we've done to kind of change that narrative within Canada. Understand the value of predicting rather than reacting. I'm sure all of you in the infodemic world know about this already. Evaluate and collect as much data as possible. I'm a big proponent of evaluating what you've done and then understanding how you can make it better. So a lot of quality improvement in your work, but also how you can, do a better job implementing your communication strategy in the future, for example. Do everything we can to improve the immunization experience for everyone. That's a big part of what we've been doing for the last 11 years, is trying to understand beyond reassuring people, the facts are here, the science is right. We haven't really been patient-centered. So how do we do that? How do we incorporate what we could call human-centered as well, practices or philosophies into what we're doing when it comes to the infodemic? So Canada has a lot of endemic barriers, and these existed way before COVID-19. And they're very, very hard to get rid of or change. And you might find that you have similar barriers in your country. So for us in Canada, immunization policy and program development is multi-tiered. And so what that means is responsibility for healthcare is at the provincial level, but immunization responsibility is shared between federal, provincial, and territorial governments. So that means each jurisdiction has a distinct mandate in unique context. And so as you can see, we have at least 8 major actors in Canada that have at some point in time play a role in the development of immunization policy and program development. And so at the provincial and territorial level, they really decide how they're going to deploy the immunization program. So they publish annual directives, so basically medical directives. They have expert committees of their own. So we have a NITAG at the national level, and then we have all these other immunization committees that also make their own recommendations. And then just to make things a little bit more complicated, they order their own vaccines. So this is an example from the influenza immunization programs of 2020 now. And this was really focused on older adults. And as you can see, and we have 13 jurisdictions in Canada, every jurisdiction has a different policy for their program, and every jurisdiction orders a different vaccine. So you can see where the problems lie here in an endemic. When you're trying to promote immunization and you have a system, an infrastructure, and a healthcare system that is structured this way, equitable access to vaccines is a front and center issue. Aside from that, we also have issues of health literacy in Canada. So OECD has a scale of 1 through 5, 1 being the lowest and 5 being the highest when it comes to evaluating health literacy. 3, according to Statistics Canada, is the minimum level required for proper understanding and literacy in matters of health. Canadians, 16 to 65 years, 55% of them have a health literacy level below 3. 12% of adults 65 years of age and older are competent in matters of health. This is really problematic for Canadians, especially when we're trying to explain to them complicated issues such as COVID-19 vaccines. And so health literacy really influences the ability of people to engage in prevention activities. And so if they don't understand what we're asking them to consent to, that's a problem. If they don't understand that beautiful fact sheet that you just produced and what's in it, that's a problem. If they can't evaluate what they're asked to do, that's a problem. And if they don't know how to access vaccines, that's another problem. So if we look at the 3 determinants of vaccine hesitancy, I know there's 5 in some circles, the ability to understand can impact the decision to be vaccinated. So that's an endemic problem in Canada. We also have health professional challenges. So supporting patient-centered care in public health is a major problem. The immunization experience is not really highly regarded. So, whether the patient is not feeling well or anxious or fearful or has pain, only now is there some movement in this space, but they don't really recognize that. And they don't recognize that as being impactful when it comes to the vaccination decision. So if you've had a really bad experience the first time, the second time probably won't happen. So if you have a series of 2 that you got to complete, likelihood of completion is going to drop substantially. And the experience is different between adults and children. So, if we're trying to help them out, we got to recognize that adults have different experiences from children. And ethno-cultures, so multi-centered approaches are needed because they all have different experiences as well. We also have a big problem of workplace stress and fatigue. So resilience is an issue. Pharmacists, for example, are constantly given new roles and responsibilities, especially in the area of immunization. COVID really opened the door for that. And they have a huge problem within the healthcare professional sector in Canada with keeping up with new information and evidence-based practices. They don't have enough education and training. We don't have a lot of certified immunizations for competency courses in Canada. We have a few, most of them you have to pay for. And if you're in a different jurisdiction, you don't have access to provinces that do have. So from a professional standpoint, it's very difficult. They also have an issue with changing vaccine delivery practices. And so when you have conflicting NITAGs or best practices between the federal government versus the provincial government, it becomes confusing for health professionals. We also have key messaging and risk communication issues. So understanding what we're putting out there, is it knowledge translation, a call to action, or both? We tend to have mixed messages in Canada. We don't have a cohesive voice. Reach and connection, who are we reaching out to? A lot of times we miss the mark. And we don't involve stakeholders, whether they be geographically representative. So for example, Indigenous communities in the North, there are hundreds of different dialects out there, doesn't always connect. Are we even gathering intelligence, whether we're connecting? We don't know. What about the unvaccinated? We don't know who they are, to be honest. We know who's been vaccinated, but we don't know who's missing. And that population data is a huge knowledge gap for us in Canada. And so effectively communicating to the people that need to be vaccinated is very difficult without the evidence. Looping back in terms of real-time messages is a problem as well. We don't have those mechanisms and infrastructure in place, leaders and champions. Who's carrying the message? It's kind of disjointed, and efforts are always on the fly rather than really planned out and delivered in a really cohesive manner. Trust. We have an issue with understanding that trust really varies depending on who you're talking to. And so that's a huge problem in Canada. And of course, the common issue that we're having with everyone else at this table is the infodemic. And of course, the infodemic is also different depending on your standpoint. So if you're a health professional, you're dealing with the flow of information, which has substantially increased because of COVID-19. How do you sift through a mountain of emails and data? I've heard that constantly again and again and again. I just don't have the time to look at it. Knowing the quality of information, believe it or not, healthcare professionals also have difficulty evaluating the quality of data that they're being given. From a public perspective, we all know true versus false, who are the sources, critical assessment of content that is really unfamiliar to them. Rely on reporters and journalists to tell the truth. And all of this has a real impact on the decision-making process, just like health literacy does. So informed decision-making has become truly difficult in Canada, especially if you are unsure. And there's a lot of people who are unsure here in Canada about COVID vaccination, for example. Now, we do have a pretty high vaccination rate, but when it comes to vaccinating the children, which we just started to do, which is the 5 to 11 age group, confidence and trust in the vaccine and the vaccination program is less than half. And that's a dramatic difference between what we've seen for the adult population. And so the challenge for us is really the same like elsewhere. We're seeing alternative news being outweighed in the sources versus scientific news. And this visual is actually dated from 2015, but I think it's still relevant. And in fact, the red sections are probably more than before. And COVID has really exacerbated this, and I don't think I need to tell you that. But Canada did make a commitment to address the infodemic in May of 2020 at the World Health Assembly. And what they did, the federal government did agree to was to work with Canadian stakeholders to provide reliable evidence-based data and to be transparent on the COVID-19 response, employ appropriate measures to address misinformation and disinformation, leverage digital technologies to mount responses to COVID-19 misinformation. And all of this was all in the context of the OECD's 4 key actions that governments and platforms need to take. So support organizations, complement the leveraging of technology, be transparent, improve digital media and health literacy skills. So everyone really agreed to this in Canada. The problem is that going back to our infrastructure, that is very much reflected in how the infodemic strategy was implemented. Or I won't even say there was a strategy, but the way that commitment was translated domestically. So at the federal level, there were coordinated responses, but among different government departments. So Health Canada had their infodemic work, Public Health Agency is doing its tracking, monitoring attitudes and behaviors. And then you had other different departments like Heritage Canada, which does cultural and education. They'd had their own department of infodemic management. So every department was doing its own thing without really, I guess, one arm speaking to the other. The other interesting piece is that if you're a public health professional like me who wants to tap into, some of the information that the Public Health Agency gathered on, trust or attitudes and behaviors, that information is not transparent. So we don't have access from an outside. So the level of sharing of information is definitely a problem and a challenge within Canada. To make matters worse, we had provincial jurisdictions doing their own coordinated response. So whether they're doing their own social media monitoring or listening, and then, they're doing their population surveys. So they had survey after survey after survey on vaccine hesitancy, vaccine confidence. And then we have us in the space of the NGO world and academic institutions doing our own bunch of research. Now we're sharing that information that we gather, but it's not necessarily reciprocal. So there's a bit of an imbalance and infrastructure challenge in Canada. To make matters worse, we have a communication strategy that is very antiquated, if I can say that. And I don't mean to offend my public health colleagues, but we really work within a space where we're dealing with a knowledge deficit model, right? So let's talk about the facts. What is the evidence? This is the science. And we do this and we beat it down until they accept what we've told them. This is a rational solution to your problem. We are presenting the best science available to you. That's not to say that it's not true. It is true. But in a world where people are hyper aware, really informed, whether good or bad, doesn't matter, that's a bit of a problem. And I think we've seen a lot of countries where that backlash is happening. And so what we've decided to do at Immunize Canada is look at helping Canadians vaccinate with confidence against COVID-19, but from a different way. Let's look at this through a different lens. So the first thing we did is we have to keep our mandate, which is public education, but we have to do it to build trust, not to break down relationships. So to do that, instead of just forcing down the science, we took a step back to explain that all COVID vaccines do the same thing, which is prevent serious illness. Okay, that's number one. How that is, how the vaccines do this, then we go into a bit of the science and the facts. So there's a bit of reassurance that is happening. So it's not just, this is the science, try to understand it, try to make what you can of it. Walking them through it. It also helps with dealing with health literacy and vaccination literacy. We also did a lot to provide the tools to help them with critically analyzing those sources that we're giving them. So you can go and check here, fact check yourself. This is what we're doing. You can go and look over here. This is what we're telling you, it's correct. And so what we also wanted to do is not have people come to us, we need to go to them. So where are the places that our target audiences will congregate and get information? So for us, it's digital hubs and social media and different forms of social media. We also went to, like I said earlier, caregivers, employers, public health authorities, but in public health authorities, not just dealing with the medical officers of health in particularly, but dealing with the health promoters. I had a health promoter this morning explain to me that the 5 to 11 clinic in their jurisdiction went okay, but they didn't have enough time to prep. So they need information, and they're getting a list this long of questions from nurses who don't feel comfortable giving the vaccine because they don't think children are at risk of COVID-19. So how do we do this in a human-centered way? So the second dynamic that we infused into step 1 and 2 was helping people to prepare for that vaccination day. So what does it feel? How does it feel like to get the COVID-19 vaccine? How can we ease discomfort during your vaccination? What can be done after vaccination to reduce the effects? So all of these things are about making people that are now in a very, vaccine hesitant individuals and vaccine refusers are quite angry. How do we make them feel that we're here to take care of them rather than just administering an intervention and move on? So, and of course, customizing those needs to multi-ethnic and Indigenous communities. At the same time, we realized at Immunize Canada that we're going to fall behind on routine immunizations. So how do we keep that going while raising awareness? And how do we capitalize on that opportunity that people are really aware, hyper aware about vaccines right now, as an opportunity to educate them about the benefits of other vaccines that they probably missed or haven't given to their children? So we created our hub on our website, which is kind of home base, but we've also done other things to reach communities and organizations. So this is a video we developed with the University of Toronto.
Thanks.
the whole thing in the interest of time, but it's just to give you an idea of how we've changed the language about how we communicate about the COVID-19 vaccines. So there's that informative, educational, but yet not knowledge deficit approach, right? We're asking, we know there are some people that are hesitant about the vaccines. They're concerned about the effects. We know that you may be one of them, but we're here to help you. We're here for you, right? And one of the things that Dr. Noni McDonald was really good at conveying last year was that people like information in different formats. So you have your snack, your bite size, your snack, and then the full lunch. So some people will want the full lunch. Other people want information in bite size or snack format. And all of that requires different thought process, different blending together of the information that you're trying to do, give and provide, and your objectives, right? And so here's a couple of examples of how we did it in a bite-sized manner. Just really quick, this is the fact, here's the call to action. The other thing, like I mentioned, was providing resources on how to prepare for vaccination day. And so these were quick fact sheets that we had put together using the CARD system developed by Dr. Anna Taddeo at the University of Toronto. And basically every acronym of the word CARD represents a strategy that you can employ to make your vaccination experience better. And it's evidence-based, it's based on clinical practice guidelines on pain management, and it's been proven through our CT research to reduce fainting. And that's a big issue. So immunization stress-related responses is a big issue, and fainting is one of them. And so if we can just eliminate that, make people feel like we're taking care of them, that we're taking care of their kids, they'll probably be more likely to vaccinate. And these are just fact sheets. We have a card game that we're going to publish very soon, so children can interactively be prepared. And it teaches children to be ready, right? What to expect, come with your short sleeve. You can bring a teddy bear, you can bring a distraction item, you can talk to someone, you can bring a friend, you can lie down, and you can ask for privacy, you can ask for things. And so what we've done also for many years is help healthcare providers and immunizers in particular. So if you're going to a vaccination clinic, parents aren't there to advocate for the children, but if we help healthcare providers when they're setting up their clinic to make the clinic environment conducive to support children that come in with, I want to play this card, I want to play my comfort card, or I want to play my distract card. It makes the whole experience different. The other thing we've done is storytelling. So infusing stories, real stories, with the science. And so below are some examples of what we've done. We've currently have a Toronto Star Hub where we have specific stories for different populations, targeting different groups, targeting different COVID-19 issues, or immunization issues in general. And it's a really nice way to get that emotional response that we say all the time the anti-vaxxers do or achieve in their posts on social media. But we can do it too, but in a positive way, not a negative way. And so what can you do as an infodemic manager when you graduate from this course? What can you do to bring all these elements into your practice or to your office or agency? Well, the first thing obviously an infodemic manager should do is work with a framework. So what framework are you going to look to employ all these different new strategies for improving the vaccination experience, for improving knowledge that is out there, okay? Countering the infodemic. This is just a framework that I developed for the VSN, but essentially some of the basic tools that all infodemic managers should have are: one, knowing your sources of information, the reliable sources, to be able to triangulate the data in order to craft the communication messages that you want to do. Knowing your target audience, knowing the different nuances, the local concerns, the community concerns, okay? You should be able to do that. So whether that's EPI data combined with local news data, combined with social media, listening data, okay? All of that should be combined. Then you have to have a strategy for building your messages. How are you gonna do it? What are the strategies? What are the issues that you have to do? Testing them. And then the big ones are implementation and evaluation. So for me, those are the key components of a framework, or any framework that you choose, that should be included for an infodemic manager. But once you walk away from this program, and even having a plan in mind on how you're going to do it and infuse it into your daily job, you might come across some internal challenges. And I've spoke about the challenges that I've had to face over the 11 years that I've been in this position, but you may come across similar ones or different ones. You may not have the infrastructure, you may not have the support internally, you may not have the budgets or the human capacity to be able to undertake what you need to in order to respond to an infodemic crisis. You may not have access to the information. Maybe you need monitoring data and you need to go outside of your organization. And you may not have the initial connections. And this is why I spoke earlier about coalitions, because they're important sources of information. And not only that, they are there to support you. So it could be a coalition, it could be a network, whichever one works for you. One of the key things an infodemic manager should do if faced with all these challenges is to find out who are your allies in and out of your organization. The other thing is, don't be shy when you're making those connections. Researchers are important people to connect with because they will help you get the knowledge to be able to make the changes internally that you need to make. And so not too long ago, there was the infodemiology event in the conference. While the infodemic folks are still struggling to really get a taxonomy together and, getting resources together and the like, it doesn't mean that you can't start doing that yourself internally. And in some way, you're going to be contributing at the local level. So it's key for you as an infodemic manager when you walk out of this, nice club that you've joined, to be able to do it there in your spot, in your position. And I think also, if you look at this event, this course program itself, it's very unique in the sense that you've developed a close niche that you can contact another infodemic manager somewhere else in the world, and they can help you get through some of the barriers that you've encountered. And this is important because eventually, as you're dealing with infodemics and you've built infrastructure, you need to be able to implement interventions in an effective way, monitor them, and then evaluate those incomes to generate new knowledge, to be able to do it all over again, and to be prepared, because you need to constantly be prepared. And that's one of the things I talked about earlier, is that we're always doing a response. We're always reacting rather than being prepared. And being prepared takes a lot of work. So essentially what I'm hoping is that when you're done with this course, you're able to be a change actor within your own organization, to be able to advocate for infodemics and developing infrastructure for dealing with the infodemics. And you're a strong advocate, so don't be shy. You have a voice, you have a position where you can make that change. And governments are willing to make that change. Canada was one of them. They just don't know how. So we need people like you to show them. Thank you and good luck.